9,252 of those deaths occurred on the day of vaccination or within 1 or 2 days. Again, I agree with you. Nobody knows how many COVID deaths were because the information was completely corrupted. Nobody knows how many lives were saved by the COVID. I think most people, okay, if you're vulnerable, raise your antibodies, reverse severity, fine. There's not any good study on that. There's just information out there, just claims being made. This is hard evidence that shows the vaccinated population far more prone to chronic illness than people completely unexposed to vaccines.
It happens all the time. We are being lied to by these agencies, and we're going to change that right now.
The Centers for Disease Control and Prevention has scaled back its broad support for COVID-19 vaccines, shifting to a case-by-case approach. Under the new guidance, vaccination decisions should now be made between a doctor and the individual. This marks a major change from the CDC's previous recommendation urging broad public vaccination. The update keeps COVID shots available through insurance, but emphasizes shared clinical decision-making. Acting CDC Director Jim O'Neill approved the change following advice from the agency's vaccine panel. The move follows months of uncertainty after Health Secretary Robert F. Kennedy Jr. reshaped the panel. Kennedy, known for his anti-vaccine stance, replaced all 17 members with his own appointees earlier this year. He previously halted CDC guidance recommending COVID vaccines for healthy children and pregnant women. The CDC emphasized that vaccination remains most beneficial for people at higher risk for severe COVID. For healthy individuals under 65, the benefit is considered lower, but the vaccine remains available. Alongside the COVID update, the CDC also revised its policy on the MMRV combination vaccine for children. It now recommends giving separate MMR and varicella shots until a child is at least 4 years old.
Thank you, Senator Johnson.
Thank you, Mr. Chairman. Secretary Kennedy, first of all, thanks you for your willingness to serve and for putting up with this abuse. 5 minutes is even close to refute all the falsehoods that have been confidently spewed during this hearing. We'll talk about real data here, okay? Well, first of all, thank you for breaking the logjam of information of HHS. My committee's got now over 8 million pages of information. Just in the first tranche, by the way, what we discovered is that the CDC, somebody in the federal health agencies, this interagency communication, hid the signal. They admitted there was a signal on myocarditis, and they hid it. They didn't warn the public. They didn't warn doctors. So that's just one instance of corruption and lies told by the CDC. We've got a lot of others we'll be rolling out, okay? So we held our first hearing in permanent subcommittee investigation on that hiding of the signal of myocarditis. We've heard a lot of studies, okay? As I've looked into science, it's been thoroughly corrupted. Here's data. And I'd like to enter this sheet into the record. I've been publishing this chart for, since really early 2021. When I'm on, for example, talk radio shows and they talk about this, they get deplatformed, or they were, because of all the censorship during the Biden administration. Here's the facts. The VAERS system that was touted in October of 2020, this great safety surveillance system on COVID, a few months later, when they didn't like the results, they started denigrating their own system. But VAERS shows that there have been 38,742 deaths reported on VAERS worldwide associated with the COVID vaccine. 38,742. 9,252 of those deaths occurred on the day of vaccination or within 1 or 2 days. Again, I agree with you. Nobody knows how many COVID deaths were because the information was completely corrupted. Nobody knows how many lives were saved by the COVID. I think most people, okay, if you're vulnerable, raise your antibodies, reverse severity, fine. There's not any good study on that. There's just information out there, just claims being made. This is hard evidence. And certainly what I've been advocating for are the injection injured, the childhood vaccine injured. We're going to be holding a hearing next Tuesday on a study done by a high-integrity healthcare facility that shows, that actually looked at vaccinated versus unvaccinated, very high-quality study. I'm not going to steal the thunder of Aaron Seary, who's going to be testifying on this. I think you're aware of the study that shows the vaccinated population far more prone to chronic illness than people completely unexposed to vaccines. That is just one example of how science has been corrupted by the way, the study was conducted, and when they conducted this, oh no matter what the results are, we're going to release this. They got the results in 2000. It is yet to be released. We're going to enter that in the record on Tuesday. Do you want to just talk about what you've witnessed in terms of the capture of the agencies that you're now in charge of, the corruption of science, which I believe you just said, that is almost your number one goal, right, is try to bring integrity and credibility back to science, which has been corrupted by the people who pay for it, by federal health agencies being captured by pharmaceutical industries, by big pharma, by big food. I want to give you, I'm sorry, just the last minute to, first of all, defend yourself, but talk about the corruption of science that you're having to deal with and trying to correct.
Yeah, I mean, I'll just tell you one example, and I could sit here and give you thousands. But in 2002, CDC did an internal study of Atlanta and Fulton County, Georgia children, and looked at children who got the MMR vaccine on time and compared those to kids who got them later. So in other words, kids who got them before 36 months and kids who got them afterward. The data from that study showed that black boys who got the vaccine on time had a 260% greater chance of getting an autism diagnosis than children who waited. The chief scientist on that, Dr. William Thompson, the senior vaccine safety scientist at CDC, was ordered to come into a room with 4 other co-authors by his boss, Frank DiStefano, who's the head of the immunization safety branch, and ordered to destroy that data. And then they published it without that fact. So you know that story, I know that story, and you know of hundreds of stories like that. It happens all the time. We are being lied to by these agencies, and we're going to change that right now.
The White House is recognized for questions.
Thank you, Chairman. Mr. Secretary, I want to talk to you about Rhode Island. When you were last sitting there, here's what I said to you. I want to read it back to you because I want it to sink in. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers, a difference of 23 and 26% in our regional healthcare market. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid. And the one act that CMS took on this issue years ago was to make it worse. I raised that with you then. I've raised it since with Dr. Oz. I've raised it with CMMI Director Sutton. I would like to get action from CMS on that. One partial avenue of relief for Rhode Island is the AHEAD program. Rhode Island is a willing voluntary participant in the AHEAD program. Coming behind Rhode Island is Connecticut. What remains to be seen is whether the payment rates agreed to for Rhode Island will suffer the same discriminatory discount with respect to the AHEAD rates for Connecticut as Connecticut comes through. I've been able to get no assurances from CMS that they care one whit about this payment differential or that they see AHEAD as a means of resolving this injustice. Mr. Kennedy, our healthcare system is teetering as a result of this. This is not a casual matter, and I would really like to see you and Dr. Oz and Mr. Dutton put your attention onto this Rhode Island problem. There is no conceivable justification for paying a hospital in Fall River 23% more than Rhode Island Hospital when Rhode Island Hospital provides more and better services, as recognized by the Secret Service, which will take an injured president from Martha's Vineyard to the Rhode Island Hospital Trauma Center, flying right over St. Anne's Hospital in Fall River, yet Fall River gets paid more. It makes no sense, and it has to be resolved. The other problem that I mentioned to you is that I'm now in my 4th round of CMMI directors. It's bloody Groundhog Day, trying to get something done about how end-of-life patients are treated. I'm offering Rhode Island as a willing example of how we can do it better. It is idiotic and cruel to force a family to put their dying loved one through 3 days and 2 nights of a hospital before they can put them in a nursing home. It is equally ridiculous to not allow palliative and curative care to happen together. Providing home care when someone is dying, even if they can still get out of the house or into the yard, is a basic thing to ask. And to have respite care be that somebody comes to the house instead of taking a dying family member to a hospital, that's not even respite. Every single one, Mr. Kennedy, of these waivers has been granted in the past by CMMS and other circumstances. All I want is for somebody to come and work out how we do this in Rhode Island. What is our patient base that we'll do this in, how we put the waivers together. To quote your CMS director, Mr. Oz, he said, as we discussed in your office, we must re-examine how end-of-life care is addressed in this country. I'm offering Rhode Island as an example of how to make it better. I hope you will concede that right now it is not good. So
Senator,
I
everything
need
you
you to respond to me. You guys know where to find me. I'm up in the Hart Building.
Yeah.
We've reached out, we've tried for meetings, and the progress in all 3 of those areas, fixing the payment gap, getting ahead balanced regionally, and following through on our desire to do good things, improving end-of-life care with waivers you guys have already granted, has gotten me so far no place. And forgive my impatience, a lot of it predates you. I put a hold on Biden nominees because I was getting jerked around by your bureaucracy. I'd like it to end and get some progress.
Yeah, you know, Senator, you raised this during my confirmation hearing, and I said to you then, and you were very civil. You raised something that makes a lot of sense to the extent that we have the power to fix it at CMS. I'd like to do it. We've had the same kind of complaints from Vermont. But I said to you at that time, call me and let's come talk about this. You have my cell phone. You can call me anytime. I've never heard from you in 7 months. Call me up. I'd love to meet with you. I'll get Oz in the meeting, and what you're saying, particularly about at the end of life, it may be something we can do something about. I want to help, and let me know.
We'll try. Forgive my frustration. You've got 30,000 employees. They could have reached out to me. They know where I live.
Yes.